Welcome to VU Academy. Today let's learn about the Alzheimer's disease. So, what's the Alzheimer's disease? Alzheimer's disease is a progressive neurodegenerative disorder that primarily affects our memory, thinking, and behavior. So, it's the most common cause of dementia. This disease is worsened over the time and it has no cure. Through treatment, it can help to manage the symptoms. In this slide, let's learn about what are the causes and the risk factors of the Alzheimer's disease. The exact cause of the Alzheimer's disease is not fully understood, but it's believed that it's a combination of genetic, environmental, and lifestyle factors that lead to the death of the brain cells. So, let's see what are the brain changes related to the Alzheimer's disease. So, they are the formation of amyloid plaques, neurofibrillary tangles, loss of brain cells. From that, the first one is the amyloid plaques. So, in this picture, you all can see that this is the healthy brain cell. Here, this is the normal brain cell. And this shows the shrunken brain with the Alzheimer's disease. In here, the brain affected by the Alzheimer's disease is visibly smaller in size due to the neuronal loss and the atrophy of the particularly areas related to the memory and cognitions. It means the areas like cerebral cortex and the hippocampus. In here, you all can see that the amyloid plaques formation. The amyloid plaques illustrates that the abnormal clumps of the beta amyloid proteins accumulating between the neurons. So, these plaques disrupt the cell communication and contributes to the brain inflammation and damage. Here you all can see that the neurofibrillary tangles. According to the picture, you can see that this is a healthy neuron and this is a dying neuron with the tangles, which it affects by the neurofibrillary tangles. They are the twisted strands of tau proteins inside the nerve cells leading to the cell dysfunction and the death. Finally, this can cause for the loss of the brain function by progressively shrinking or the atrophy of the brain and by the enlargement of the ventricles. In this slide, this picture depicts how the neuroinflammation occurs with the influence of the microglia and the astrocytes. These microglia are the brain immune cells which attempts to clear the amyloid plaques by chronically activation, resulting the releasing of pro-inflammatory cytokines. So in here you all can see how the cytokine overproduction occurs. So this chronic inflammation will pave the way for the neuronal damage. And these are the astrocytes which contributes for the inflammation and the oxidative stress. So when these astrocytes are damaged by structurally and functionally, it will lead for both cognitive decline and the synaptic dysfunction. Here you all can see that there is a synaptic loss occur. Now let's move into our next slide. So in this picture, it depicts about how the cerebral cortex, including frontal, temporal, and parietal lobes, as well as hippocampus, is affected. As we all know, our frontal lobe is responsible for decision making and personality development, and the temporal and parietal lobes are responsible for language and spinal awareness. Then hippocampus plays a key role in the memory formation. So by affecting to the Alzheimer's disease, it will progressively shrinkage our brain. So it's called the brain atrophy. So here you can see the cerebral cortex, which is responsible for the language and information processing. Now here the Alzheimer's disease, the cortex is shrinking up. Therefore, it will damage for the in thinking, planning, and remembering, as well as the ventricles. Here it shows the ventricles filled with the cerebrospinal fluid. So these areas become enlarged. In this slide, let's say what are the risk factors that related to the Alzheimer's disease. They are the age, genetic factors and mutation, oxidative stress and inflammation, mental health and sleep disorders, environmental toxins, lifestyle factors, head trauma and cardiovascular diseases. Now let's move one by one. The age. The age is the biggest risk factor because most of the Alzheimer cases are occurring after the age of 65. Then the genetics also play an important role because the family history also increase the risk for affecting this condition. In here, especially mutation of the genes like ApoE4 will cause this disease. The head injuries or the traumatic brain injuries will also increase the risk of Alzheimer's disease, and also the cardiac health contributes towards this Alzheimer's disease. The high blood pressure, diabetes and high cholesterol contributes to the brain damage. Then the other one is the lifestyle factors like poor diet, lack of exercise, smoking, and social isolation may increase the risk for Alzheimer's disease. Now, in this slide, let's learn about what are the stages of the Alzheimer's disease. It has four main stages. They are the mild cognitive impairment, mild Alzheimer's, moderate Alzheimer's, and final one is the severe impairment. In the first stage, it means in mild cognitive impairment, what happens? The disease begins in the medial temporal lobe. So it shows the symptom as short-term memory loss. After that, it progressively develops into mild Alzheimer's condition. In this condition, the disease spreads to our lateral, temporal, and parietal lobes. So in here, it takes about 2 years, and reading problems, poor object recognition, and poor direct sense are the symptoms. Then it will develops into moderate Alzheimer's. Here, the disease spreads to the frontal lobe. Then you can see the frontal lobe. The symptoms are reading problems, poor object recognitions, poor direct senses, likewise. Then the final stage of Alzheimer is the severe impairment. In this stage, the disease is spread to the occipital lobe, and visual problems occur during this stage. Let's see what are the diagnoses related to the Alzheimer's disease. They are the medical history and cognitive test, brain imaging, and the biomarkers. In the medical history and cognitive test, memory problem solving assessments are given. And in the brain imaging, the MRI and CT scans check for brain shrinking or other issues are going on. And in the biomarkers, it includes both blood test and spinal fluid. So those tests will help to analyze and detect the beta amyloid and the tau protein levels. So, in the first picture, it shows a brain MRI scan, often reveals the brain atrophy or the shrinkage and the enlarged ventricles and reduce the hippocampal volume, which will cause a memory loss and the cognitive decline. Then this second image shows the PIB PET amyloid imaging, a brain scan technique which used to detect the beta amyloid plaques. Let's see what are the treatments related to the Alzheimer's disease. So in this image, it provides a review of the advancement of the treatment modalities for the Alzheimer's disease, highlighting both the modifiable risk factors and the emerging therapeutics. The modifiable risk factors are like smoking, alcohol consumption, exercise, and healthy foods are related factors that can potentially reduce the risk of developing this Alzheimer's disease. So in this slide, you all can see it represents the advanced therapeutic strategies of Alzheimer's disease. So they are the gene therapy, nanoparticles, amyloid beta immunotherapy, as well as the contemporary therapeutic approach. So, according to this picture, the nanoparticles are the targeted drugs that deliver into the affected brain's area. And the gene therapy, it will help to investigate what are the genetic modification which helps to slow the disease progression. And in the amyloid beta immunotherapy, it involves the vaccines or the monoclonal antibodies that target the amyloid plaques. In contemporary therapeutic approaches, it refers to the cognitive therapy, behavioral therapy, and the symptomatic treatments. In this slide, let's learn about the treatment and the management of the Alzheimer's disease. It means what medications are used to treat the Alzheimer's disease. Mostly the medication which used for the memory loss are the cholinesterase inhibitors. The cholinesterase enzymes, especially acetylcholinesterase, plays a key role in breaking down of the acetylcholine, which is a neurotransmitter which is essential for the memory, learning, and for the cognition. In the Alzheimer's disease, there is a significant loss of the cholinergic neurons, leading to reduce the acetylcholine levels in the brain. So, it leads to the cognitive decline. So, for the treatment of Alzheimer's disease, cholinesterase inhibitors like donepezil, rivastigmine, and galantamine are used. So these drugs, these drugs are doing? They block the cholinesterase enzyme and increase the acetylcholine levels and temporarily improve our cognitive function in early to moderate stage of this disease. So this is about the treatment of the Alzheimer's disease. Now in this slide, this image provides the information about the non-pharmacological management of the Alzheimer's disease. So here's the sleep better. It shows the sleeping better will improve the overall well-being and feeling calmer and happier through social support and emotional care. The next picture showing keep up with daily activities will help to maintain the independence for as long as possible. Here it depicts that adjusting lighting to create a comfortable environment. And the next picture shows the listening to favorite music will stimulate the memory and emotion. Finally, looking at photos and talking will help to recall the memories and the communication of the Alzheimer patients. Here it shows what are the lifestyle changes related to the Alzheimer's disease. They are the regular exercises, using a Mediterranean diet, and mental stimulation as well as social engagement. Now let's see what are the support and the caregiving related to this condition. They are the professional care, caregiver supports as well as the safety measures. Thank you for watching. Please subscribe my channel. Bye bye.